this issue, and I would urge passage of the Portman Amendment as well. Madam President, I'd like to go to another amendment if that would be appropriate at this time.
Without objection.
I would call up Amendment 2121.
The clerk will report. Senator from Iowa, Mr. Grassley, proposes an amendment number 2121. At the end of Title 11.
I ask that we suspend the reading of the amendment.
Without objection, so ordered.
Madam President, the bill before us, S-3187, did not address a top priority of mine, and that is ensuring whistleblowers having adequate protections. 4 months ago, my office learned of a very abusive treatment by the FDA on certain whistleblowers due to those whistleblowers' protected communications with Congress, more specifically with this senator's office. Once the agency learned of the communications, even though they were on personal email, it began actively monitoring and observing employees' personal email, as you might expect. And they observed those email accounts for 2 years, for a whole 2 years, until the agency was able to have the employee fired. Well, you know, whistleblowers shouldn't be fired for doing what's patriotic, and that is reporting to Congress wrongdoing. Regrettably, I was shocked to learn that the FDA was mistreating whistleblowers within its agency, as it has done. I said that wrong. I was not shocked to learn that the FDA was mistreating whistleblowers within its agency, as I pointed out to my colleagues on so many occasions that the FDA has done that. And I've been reporting those things ever since the Vioxx situation of 2004, I believe. What makes this example different, though, and even worse, is that the FDA intentionally went after an employee because it knew that that employee was not covered by the Whistleblower Protection Act. Now, it might surprise some of you that all employees aren't covered by the Whistleblower Protection Act. But this employee in question was a member of the Public Health Service Commission Corps, and because of a decision from the Court of Federal Claims, these employees, meaning the Public Health Service, along with other members of the uniformed services, are not covered by the federal employee whistleblower protections. Now, I think the court case was wrong, but anyway, that's the way the Court of Federal Claims ruled. And that ruling came in the Verbeck versus United States case that an officer in the Public Health Service Commission Corps is a member of the uniformed service and as such is not covered by the Civilian Whistleblower Protection Act, nor even the Military Whistleblower Protection Act. This same logic extends to the Commission Corps of the National Oceanic and Atmospheric Administration as well. So under the precedent of this Verbeck case, the officers of both the Public Health Service and NOAA currently have no whistleblower protection under federal law. This is particularly problematic when you consider that the Public Health Service and NOAA officers can be detailed to agencies like the FDC or the Center for Disease Control. There, these officers working in another agency happen to work side by side with civilian employees of that agency doing very critical work to review and approve drugs, oversee medical devices, and even work on infectious diseases. However, unlike their civilian colleagues, employees of that agency that are sitting right next to them, if these employees uncover wrongdoing, waste, fraud, and abuse, they can be retaliated against by the agency and have no recourse for it, and that's exactly what happened to this Public Health Service employee working in the Food and Drug administration when they reported to Congress wrongdoing there. And they did it by personal email, and the FDA got onto it and then fired the one employee that was reporting to Congress, but not firing the employees that were protected by the Whistleblower Protection Act. So that's why I say this is wrong and it needs to be fixed, and this amendment will fix that. Whistleblowers point out fraud, waste, and abuse when no one else will, and they do so while risking their professional careers. Whistleblowers have played a critical role in exposing government failures, and retaliation against whistleblowers should never be tolerated. For this reason, I offered an amendment that expands whistleblower protection for uniformed employees of the Public Health Service. It corrects the anomaly pointed out by the Court of Federal Claims and ensures that officers in the Public Health Service have some baseline whistleblower protection. It expressly includes the Commissioned Corps of the Public Health Service within the protections of the Military Whistleblower Protection Act. This is consistent with the structure of the Commissioned Corps functioning like a military organization and matches the fact that these officers receive military-like benefits in retirement. Unfortunately, this amendment, which I was able to get into this legislation, only covers employees of the Public Health Service. It does not address the Commissioned Corps of NOAA because of other senators' concern that is not related to the underlying bill. So I hope to be able to address that remaining gap in whistleblower protections in the near future so that all employees of the federal government are so covered. All federal employees should feel comfortable expressing their opinions both inside the agency they work on as well as to Congress. The inclusion of this language will ensure those opinions receive appropriate protections. I want to take this opportunity, as I did opening my comments on these two amendments, to express my appreciation to Senators Harkin and Enzi and their commitment and efforts over the years to reform and improve the FDA. I yield the floor.
President.
The senator from North Carolina is recognized.
Madam President, what's the pending business on the Senate floor?
It is Grassley Amendment number 2121.
Madam President, I ask unanimous consent to set aside the pending amendment and to call up Amendment 2130.
Without objection, so ordered. The clerk will report. Senator from North Carolina, Mr. Burr for himself, and Mr. Coburn proposes amendment number 2130.
Is read.
Without objection, so ordered.
Madam President, let me also reiterate what my colleague just said, that Chairman Harkin and Ranking Member Enzi have done a wonderful job with a very complicated bill, navigating what was a negotiation that members of Congress never played a part of, a negotiation that happens between the Food and Drug Administration and the pharmaceutical industry for one piece, the device industry for another piece, and the generic drug industry for a third piece. And I might say that third piece, this is the first time that Congress will consider this. I think it's important that members of the United States Senate, members of Congress, the American people understand that typically all legislation is crafted in the Congress of the United States. It's not negotiated in the back room of the Food and Drug Administration and the device or pharmaceutical or generic drug manufacturers, except for this. And in fact, my amendment gets at the heart of it. It's called the Amendment to Ensure Transparency in the FDA User Fee Agreement Negotiations. It's straightforward. It would ensure that transparency in the FDA and drug and device user agreements, negotiations would allow members of Congress or their designated staff to attend the negotiations between the FDA and the industry. Now, What a novel thing to say that those that are responsible to actually implement the policy could sit in the room and listen. I'm not talking about playing a role in negotiating. Let me just say, why is this amendment necessary? The bottom line is that while the FDA may consult with many of the stakeholders at various points in the process, the drug and device user fee agreements are not negotiated where members of Congress and where the general public knows exactly what's in it. Congress is effectively shut out of the process until the negotiated deal behind closed doors is announced. In other words, we're presented what they have negotiated and basically told, here's what we want you to pass. At no other point in the legislative process does it happen like this in the Congress of the United States. The drug and device user fee agreements have significant implications for the American people as well as Congress's ability to do oversight. The number one role of the Congress of the United States is to serve on behalf of the American people as an oversight tool on federal agencies. Congress should not have to read between the lines of the minutes of a negotiation to try to figure out, in fact, the spirit of those negotiations. The ability for Congress and the American people to fully understand and weigh the negotiated agreements and the implications they present for patients, taxpayers, the FDA, and for Congress would greatly be improved by ensuring that Congress might attend the negotiations. Now, some of my colleagues will probably come down and suggest that this amendment would put Congress at the negotiating table and potentially it would jeopardize negotiations. It's not true. It's not what I'm attempting to do with this amendment. The amendment merely states that if a member of Congress wants to attend, or if they want to have their designated staff attend in their place, that they may. This amendment does not call for members of Congress to participate in the negotiation, or certainly staff. The negotiations would still be between the FDA and the industry. But it does not ensure that members of Congress or their staff may be in the room and be informed of the negotiations in real time. Congressional staff may be required to comply with all the applicable confidentiality agreements. The FDA's negotiations with the industry would not be jeopardized. Let me say that again to my colleagues. Would not be jeopardized because the members of Congress or the staff would be there just for observation purposes. Let me suggest that if us being in the room jeopardizes the outcome, then we wouldn't be allowed to attend the Supreme Court when some of the most important cases are tried across the street. But members of Congress and their staff regularly sit in and listen to the arguments that are made. The fact is, Congress should not have to wait to be informed of how FDA's public health mission could be strengthened and improved on behalf of patients. By having the option to attend the negotiations, Congress and their staff would gain invaluable insight into how Congress can work with the FDA to ensure that the agency is fulfilling its public health mission on behalf of patients. Now, Congress has a critical role to play in the process. When negotiated user fee agreements arrive on our doorstep, we're expected to take them up, and we're expected to pass them quickly without change. Let me say that again. We're expected to take them up. We're expected to take them up quickly because we don't want to break the continuity of the user fee agreements, and we're expected to do it without change because to change those agreements would be to break what was negotiated. Well, let me suggest to my colleagues, this is the only time in the legislative process where Congress is asked to take somebody else's negotiated product and not to provide the input of 2 senators from every state or every member of the House of Representatives. It completely goes around the structure, the legislative structure of the Congress of the United States, something that has been tested and tested for over hundreds of years. So Congress is told to tiptoe around the agreements, and we focus our efforts on belt and suspenders policies to complement the agreement. This doesn't make for the most deliberative process in considering how Congress can work with the FDA and industry to strengthen and improve FDA's drug and device work. As a matter of fact, I'd say to my colleagues, as we talk about health care policy in this institution, where our goal today is how we reduce the overall cost of health care, remember as we sign off on this user fee agreement that every dime that's transferred from the industry to an agency means that that industry is going to have to raise the price of their products to accommodate what they're paying. What are we here doing? We're raising the cost of pharmaceutical products, devices, and for the first time, we're raising the cost of generics because an industry has negotiated something outside of the walls of the Congress of the United States. FDA faces an unprecedented challenge today, challenges we could have not envisioned generations ago. The agreements, many of the provisions in the Senate bill are intended to help address these real challenges the agency's facing. But I ask my colleagues this in closing. What if they don't? What if they don't address the challenges? What if now generic drugs become more expensive than some people can pay because of this agreement? That's why it's absolutely crucial that Congress play a part in this role to balance this policy. Where will we be in 5 years when it's time to renegotiate this agreement? Well, Madam President, I hope that we're in a much better situation than we are today, that we actually have the right matrix in place through this legislation. Not something that was negotiated between the FDA and the industry, but something that the Senate of the United States put into this language that gives people on both sides of the aisle the ability to have a yardstick of measurement of success. Did the agency live up to what they promised this industry, and more importantly, does that compute to a beneficial product for patients across the country? I hope that's what we'll find 5 years from now. It's what we've tried to construct in a very difficult and challenging piece of legislation. I will tell my colleagues this is not an amendment I will ask for a vote on. At the end of the day, the reality is that this probably upsets the apple cart a little too much. But I think it's absolutely crucial that somebody ask the questions of how can Congress legitimately stand here and allow something this complex and this important to be negotiated without the input, the full input, of the Congress of the United States. Again, I conclude the same way I started, that I think that Chairman Harkin and Ranking Member Enzi have done a magnificent job of navigating a very difficult issue. And they deserve a tremendous amount of credit for taking a negotiated product and incorporating what I think are some very, very positive changes that make this a better product than was negotiated by the private sector and by the agency. My only wish is that next time we do this, that we won't have to try to figure out why certain things happened in the negotiations. We'll be privy to those negotiations, and we'll better understand how collectively we can take an agency and an industry and public policy and move it in a situation where the American patients are the beneficiaries of it in a much more effective way than I think we have today. I yield the floor.
Madam President.
The senator from Wyoming is recognized.
Thank you. I want to thank the senator for his comments and his insight and his idea. I appreciate that we're not going to be voting on this one right away because I think this needs a little time to germinate. I think it is something that as people look at it and think about it, they'll recognize the value that there would be if we had more insight into what the negotiations were. not just on this, but perhaps on regulations that are being done as well. And I really want to thank the Senator, though, for the way that he's dug into the entire user fee bill and made some very substantial changes in a number of other places. I don't know of anybody that works as hard on the medical issues as Senator Burr does, and understands it and gets into some of the details. And of course, he's worked all of these when he was in the House and now works them when he's in the Senate, and is our foremost expert on any of the pandemic issues, and was very successful earlier in the year in getting that bill through the United States Senate. And he's been very cooperative on the other amendments, which are now part of the bill that we won't be voting on because they're already in there. And I appreciate this one more suggestion and suggest that that's something that we should take a look at. I'd yield the floor and reserve the balance of the time.
Madam President.
The Senator from Iowa is recognized.
Madam President, I just want to join Senator Enzi in thanking Senator Burr for being not only a very valuable member of our committee, but I would say that the Senator's fingerprints are a lot on this bill that we have before us here. He's really worked very hard on this bill and helped, I think, to improve it every step of the way over the last year. I was just looking through the list of different things there, and Senator Burr was one of the leaders on our working group on the supply chain, which we have in this bill to make sure that those things are coming from other countries, that we have good manufacturing practices on them, and we can keep track of those. The provision of clarifying the least burdensome standard on clinical data for device approvals was also the result of the Senator's hard work. The Senator was also in the working group on the GAIN bill in terms of addition regarding antibiotic incentives, for getting more incentives for new antibiotics. And there was a Burr-Coburn bill regarding enhanced reporting requirements for FDA, and that basically was also included into the bill that we have in front of us. So in just every respect, the Senator from North Carolina has been is a great member of our committee, a very valuable member of our committee. As I said, we're looking at the amendment that he's now brought up, and I'm sure, as the Senator Enzi said, we'll be talking about this in the next few hours and going into tomorrow. But I just, again, want to pay my respects to the Senator from North Dakota and thank him so much for all of the hard work he's done on this bill. I yield the floor.
Madam President.
The Senator from Minnesota is recognized.
Thank you, Madam President. Madam President, I'd like to thank my friends on both sides.
Senator, who yields time?
Madam President, inquiry. Is the Senator bringing up? Oh, no, the Senator does not have an amendment pending.
The FDA bill.
Does the Senator wish to speak on which amendment?
Not on an amendment, just for the bill overall.
I would, Madam President, how much time is remaining on the Grassley amendments, those amendments offered by the Senator from Iowa?
The senator from Iowa has 9 minutes, and the time in opposition is 15 minutes.
I would ask, how much time does the senator wish to take?
Well, it's about 10 minutes.
I would ask that 10 minutes of the time from the opposition to the Grassley amendment be allocated to the senator from Minnesota.
Is there objection? No objection?
I
Ordered.
object to the Grassley amendment. I don't know.
The senator from Minnesota.
I'm joking. That was okay. Thank you. I'd like to thank the senator from Iowa for that. Madam President, I'd like to thank my friends on both sides of the aisle for their work on the legislation that we are considering today. The Food and Drug Administration Safety and Improvement Act is not only among the most important pieces of legislation that we will consider this year, it's also the product of more than a year's hard work and negotiation. This legislation will help support a culture of innovation in this country. It will help millions of Americans access the life-saving medications and devices they need when they need them. And as a member of the Health Committee, I'm proud of the bipartisan bill before us today, and I look forward to passing it into law. And let me tell you why. And, of course, the presiding officer spoke so eloquently about this bill earlier that the presiding officer doesn't really have to know why, but let me tell you a story about a little girl in Minnesota, from our state, named Josie. Josie seemed perfectly healthy when she was born, but at 9 months of age, Josie's parents found out she had a rare congenital heart disorder, a condition with the scary name of atrial septal defect, which means she had a hole in the wall between the two upper chambers of her heart. When the doctors tested her, they found that Josie had not one, not two, but 3 holes in her heart, and it became clear that what was originally a fairly simple surgery to repair the hole was actually a lot more complicated. But Josie is lucky. Josie's parents live in Minnesota. And Josie's doctor, Dr. Daniel Grunstein, works at the University of Minnesota. Dr. Grunstein was able to operate on Josie's heart because he had a brand new device that the FDA had approved only months before. The device, which was also developed in Minnesota, saved Josie's life. Because of this procedure, Josie was acting like her same old silly self the very night of her operation, and she walked out of the hospital the next day. A few years later, when Josie's little sister Jenna was born with the same congenital heart defect, Dr. Grunstein repaired her heart using the very same device. But too many children like Josie and Jenna aren't so lucky. Too many children don't have access to the medical technology that they needed to save their lives or to prevent their illness or to help them recover from their rare condition. That's because too many medical devices get stuck or delayed in the agency that regulates our medical technologies. And it's because we don't do enough to support a culture of innovation in this country. Look, the Food and Drug Administration has a tough job. The technologies they regulate are moving at the speed of light, and they don't have the workforce or the expertise to know everything about every new treatment. In fact, the number of annual 510K submissions, that's the most common kind of new device application the FDA receives, has quadrupled since 1976. That's why when the Health Committee sat down to develop this legislation, we agreed that we had to streamline the FDA's processes and make them more efficient. We agreed that we had to do more to support a culture of innovation, which will help manufacturers get safe technologies and treatments to patients. And that's exactly what the bill does. And I thank both the chairman and the ranking member. It requires the FDA to stop using vague FDA days and start using regular calendar days like everyone else. It lifts restrictive constraints on the FDA's consultation with outside experts, something that the presiding officer knows well about. Outside experts like at the University of Minnesota. And it creates new incentives for manufacturers to develop treatments for people with rare diseases and conditions like Josie and Jenna. These provisions will support innovation and will remove red tape from the process. The three provisions that I championed are included in this legislation, in addition to the base bill, which we negotiated as a committee. The first provision will strengthen the Food and Drug Administration's workforce by removing overly restrictive requirements that keep the FDA from consulting with outside experts. Again, something that the presiding officer has been a leader on as well. This provision will change the rules that keep the FDA from talking with many outside experts. It will make these rules consistent with those of all other agencies, including the National Institutes of Health. So, as the FDA's experienced workforce retires, the FDA will be able to consult with leading experts when they are reviewing a new technology or a new treatment for a rare disease. This provision will give the FDA the flexibility it needs to consult with experts and keep patients safe, and at the end of the day, that means more patients will get the health care that they need. The second provision will require the FDA to remove new and burdensome guidance on the industry that could triple the number of required new submissions for existing devices. This provision, which Senator Burr also championed from North Carolina, will prevent this guidance from overburdening both the industry and the FDA, which could have caused innovation to come to a screeching halt. And my third provision will help companies develop innovative new products for patients across the country with rare conditions. According to the National Institutes of Health, 25 million Americans struggle with a rare disease, and these patients have to jump hurdle after hurdle to get the care that they need. Many of them will go from doctor to doctor for years before they find a specialist who understands their condition. Now, if you live in rural Minnesota, you may have to drive hundreds of miles to find a doctor who can help you. Even for patients who find the right doctor, too often the treatment for their condition doesn't exist or hasn't been approved. So my provision will reward companies that choose to develop treatments for patients with rare diseases. We did this in 2007 to help companies develop devices for children with rare conditions, and we saw the number of devices that companies developed quadruple in just a few years. This provision will help get treatments to adult patients with rare conditions in Minnesota and around the country and really around the world. Minnesotans know what it means to foster a culture of innovation. Our manufacturers have developed new treatments for everything from skin lacerations to brain aneurysms, and this bill will go further to support this kind of innovation by streamlining the processes that are currently impeding investment in new technologies and making the FDA more efficient and predictable. This legislation will help patients in Minnesota access the medical technologies they need, just like Josie and Jenna. And in a time of economic hardship, it's an investment in one of our country's strongest industries, one of our state's strongest industries. This bill is a step toward a healthier future for our country, and I look forward to making sure that it becomes part of our law. Thank you, and I yield the floor. And again, I thank the senator from Iowa and the chair of this committee, and I thank the ranking member for his leadership as well.
Madam President.
The senator from Alaska is recognized.
Thank you, Madam President. At this time, I would ask unanimous consent to call up amendment number 2108.
Is there objection? Without objection, the clerk will report. Senator from Alaska, Ms. Murkowski, for herself and others, proposes an amendment number 2108. At the end of Title 11.
Further reading of the amendment be dispensed with.
Without objection, so ordered.
Thank you, Madam President. I rise today to speak to an amendment that we will have on the floor tomorrow afternoon. This is an amendment that certainly has generated a fair amount of interest within my state. In fact, really most of our coastal states, anywhere where we have an interest in seafood and the seafood industry. It has been kind of unceremoniously dubbed the Frankenfish Amendment, so my apologies to my colleague who just yielded the floor to me. Certainly no affront to him, but what we are speaking about today is a genetically engineered salmon. And it has been somewhat affectionately dubbed Frankenfish because of the images that this genetically engineered fish conjures up. A fish that would literally be growing in size, doubling in size, unlike the fish that we see in our streams and in our water. So what is happening today is the FDA is on path to approve an application for this genetically engineered fish. And I want to discuss the amendment that I have filed, which would require NOAA to conduct a full environmental assessment and analysis of economic impacts to affected fisheries before the FDA approves any of these genetically engineered fish. So I start my comments by saying I am not looking to pull the plug on the FDA. I am not looking to insert Congress's judgment into the FDA process. I am asking that when we are talking about basically a new fishery for a modified salmon, I'm asking that the agency that is tasked with our fisheries have some role in what is moving forward. So let me give you a little bit of background in terms of what we're talking about with this genetically engineered fish, this Frankenfish. This would be a fish, an Atlantic salmon that has DNA spliced from a Chinook salmon with that of what they call an ocean pout, which is some kind of an eel type of a fish that apparently is in colder waters. But the technology that FDA is looking at that would allow for this genetic engineering would essentially provide for a fish that would grow to market size in about half the time of a conventional salmon. So in other words, a salmon out in the wild takes about 30 months to gain full maturity. With this Frankenfish, or this genetically modified salmon, they could be of good market size, basically good eating size, within about 15 to 18 months. So you're thinking, okay, well, how can this be bad? We get a salmon that looks like a salmon, and it comes to us in half the time. So how can this be a bad thing? And I would like to share with you why I feel this is a bad thing. And when I'm talking, you will hear me talking about salmon, because that's what the FDA process is engaged with right now. But I will tell you that we understand that similar efforts are underway to develop a genetically modified trout as well as genetically modified tilapia, again, designed to grow faster than occurs in nature, out in the wild. The pending application for the salmon would be the very first food from a transgenic animal that's been approved by the FDA. So this is really precedent setting. People have suggested that, well, we see this in other forms of agriculture, but the fact is this would be the first food from a transgenic animal application that has been approved by the FDA. So this is really quite precedent-setting. What is happening is this approval process for the genetically engineered fish continues to move forward as a new animal drug rather than what it really is, what I mentioned before, which is a new fishery for this modified salmon, this salmon that has been tinkered with, basically a test tube salmon. So the reasons why I think this is a bad thing to be messing with Mother Nature and to encourage this unnatural growth. We heard on the floor this morning, Senator from New Jersey, Senator from New York both stood and talked about a measure that's out there, the march that was out on the Capitol yesterday, mothers concerned about toxins in the food supply, toxins in the world around us, and knowing what is out there, knowing what we are exposed to. Well, I, along with many consumers out there, am concerned about genetically engineered animal products that are intended for human consumption, including those that are in our marine resources. Now, I'm not the best cook in the family, my husband is, but I want to know, he wants to know, our kids want to know that what we're eating is good and safe and sound. At home, we eat a lot of salmon. And I can stand there and tell my kids, eat this. This is brain food. This is good for you. It's loaded with omega-3 fatty acids. It's as good as you can possibly get. And I can say that with certainty. We can't say that. We won't be able to say that with this genetically engineered fish. As a mom, I'm not going to say to my kids, eat this frankenfish. Not quite sure what an eel pout is or an ocean pout. Not really quite sure how they splice this DNA together. Not quite sure whether they've really made it sterile or not. Not quite sure what it is, but go ahead and eat it because it came to market quick, and we're going to be able to get a cheaper price on it. I think we care. We want to know. We want to know the process here. And the scary thing with the FDA right now, they are very reluctant, Madam President, to label genetically engineered products, even though it allows the public to know what they're eating. The data out there is pretty clear. Higher human allergen effects with genetically engineered fish. Now, if you're a mom and your kids have allergies, are you going to look at this fish and say, I wonder if this is going to set your allergies off? No. You know what you're going to do? You're going to stay away from it. You're not going to serve that to your kids. You're not going to serve that to your family. Even though you know the wild stuff is good, is healthy. But how do you know which is which? If the FDA isn't moving forward to label, and you're not quite sure whether or not what you're buying in the grocery store is as advertised, how are we helping the consumer here? How are we helping them at all? So the first problem that I have is this is again a product that's intended for human consumption, and we've got some real concerns about the safety of the food, the safety of it in the first place. Second, and this is one that, as an Alaskan where we have very strong fisheries, very healthy fisheries, I worry about what will happen if, in fact, there is escape into the wild by these genetically engineered fish. You've got a frankenfish that gets loose. Now, they'll tell you they're going to be in pens. We will make sure that there's no escapement. But how can they guarantee that? How can they make sure that we're not going to see escapement? We've seen escapement clearly from the farm fish that come and mingle with the wild stocks. We see the disease that can be transmitted. How is any of this good? Even though this genetically engineered fish supposedly is going to be kept in a closed system, onshore pens, the possibility of escape, it is recognized, is still out there, it still exists. And then what you're going to have these genetically engineered fish that are going to breed year-round. They are also going to be eating year-round. They're going to be feeding year-round, and what you can very possibly see is this competition with the wild stock. They will compete with one another for the food that the species feed on. They'll wreak havoc with the ecosystem. So you are introducing, and granted not intentionally, but you can introduce into the ecosystem a fish that just doesn't work with our wild stock. Unlike hatchery-produced fish, these genetically engineered fish would reportedly be sterilized and their hormones altered. But many scientists believe that the FDA testing to confirm the agricultural safety and the sterilization of these fish is sufficient. We see this in the CRS report that has looked specifically to this issue. So unlike other agricultural products, if you've got an escape of frankenfish, it would be to an uncontrolled marine environment, exposing the ecosystems to associated risks. If you have a cow that has been genetically modified, the cow is on land, gets out of the pen, you have more ability to control. You don't have the ability to control in a marine environment. It's just not possible. So what is happening is we are putting at risk the health and the safety of our wild stocks. Unacceptable. Third, many find the FDA process for approving an animal product intended for human consumption, as it would a veterinary drug, to be insufficient. It lacks the robustness and the transparency that one would expect for a product that would be treated as a substitute for fish that's currently on our dinner plates in this country today. The CRS report, which I just mentioned, and I'd like to introduce to the record a report by CRS dated June 7 of last year, Genetically Engineered Fish and Seafood Environmental Concerns. And one of the concerns that is raised in this report, and I quote, "A National Research Council report stated that transgenic fish pose the greatest science-based concerns associated with animal biotechnology, in large part due to the uncertainty inherent in identifying environmental problems early on and the difficulty of remediation once a problem has been identified." Madam President, our fishermen are very, very highly regulated. Any change to a federal fishery, including a new GE fishery, should be analyzed for environmental effects and economic impacts to affected businesses and fishing communities. That's what we're doing in this simple amendment. We're bringing NOAA in to say, be part of this process. And then the last point that I'd like to make on this is the very significant economic consequences of approving a genetically engineered fish. Historically, the entrance and the growth of farm salmon in the marketplace has had negative impacts on our salmon industry. We've got incredible, abundant wild stocks. We're very proud of it. It is the seafood industry in the state of Alaska is our second largest employer, 500 million ex-vessel value with salmon alone. But the concern is, although we have very strong wild stocks, we could see the market respond with fear. Unreasonable, but still respond with fear and confusion to the introduction and the growth of engineered fish, particularly if it is not labeled. This, in my opinion, could have devastating impact on our fish industry, the jobs that it supports, and clearly at a time that it can't afford it. Now, some will come back and say, hey, this is a new industry, it's going to create new jobs. Well, I'll take you back to that CRS report, and one of the things that I find kind of interesting is to address the concerns that have been raised, this Aqua Bounty company is proposing producing all the salmon eggs in Canada, then they ship them to Panama, they grow and process in Panama, and then they ship this fish, this frankenfish, to the United States for resale. So basically, we get all the harm, we don't get any jobs, But what we're doing is we're putting at risk the existing jobs within the seafood industry in this country. Priority number one. Madam President, I see that my time has expired. As I mentioned, I would ask that the CRS report be made a part of the record, as well as several letters of support support for my amendment that I would ask to be included as part of the record. And with that, I will yield.
With that objection, so ordered. Thank you. The senator from Maryland is recognized.
Thank you, Madam President. I would ask consent that the pending amendment be set aside so that I can call up Amendment 2125.
Without objection, so ordered. The clerk will report.
The senator from Maryland, Mr. Cardin, proposes amendment number 2125.
Madam President, I now ask consent that that amendment be set aside so I can call up Amendment 2141.
Without objection, the clerk will report.
The senator from Maryland, Mr. Cardin, proposes amendment number 2141.
Thank you, Madam President, and I would ask consent that my entire statement be made part of the record.
Without objection, so ordered.
And first, let me thank and congratulate Senator Harkin and Senator Enzi for their incredible work in bringing forward this bill that is so important to the public health of our nation. We are dealing with the safety of drugs, biologics, medical devices, our nation's food supply, vaccines, cosmetics, and the list goes on and on and on. And it's critically important that we have the proper authorization so that the FDA has the resources it needs to advance innovation into the marketplace of products that fall within the jurisdiction of the FDA. We know that the basic research is done at NIH, but then to get products to market, it's important that FDA has the resources in order to move the process forward. I am proud of the 11,000 workforce that are headquartered in Silver Spring, Maryland for the FDA, and we know that they work very hard. I think this legislation, this reauthorization of the user fees will give them the tools in order to get the job done, and I'm particularly impressed that this is a 5-year reauthorization bill that will give the predictability that's needed in order to get the job done. So I do want to applaud Senator Harkin and Senator Enzi. We don't see enough of these bills moving forward with the type of process that our leaders have brought forward. You've resolved a lot of the issues, and we thank you for that. You've brought us forward a bill that enjoys broad bipartisan support and is in the best interest of our nation, and I'm proud to support this legislation and thank you for the manner in which you have proceeded in the committee and now on the floor. I also want to just point out that this bill deals with the drug shortage issues. Madam President, I applaud your efforts, Senator Klobuchar's efforts in dealing with the drug shortage issues. We need more effective notification of potential shortages so that we can have appropriate action to make sure that the people of this nation have an adequate supply of medicines. Let me just share with my colleagues a letter that I received from Carrie Fitzmaurice of Bethesda, Maryland, who is undergoing treatment for ovarian cancer. She wrote me, "My doctor put me on Doxil and carboplatin to try to get rid of some tumors. Doxil was chosen because of the recent research showing that it works especially well with those patients in BRCA gene, like me. I had 4 treatments with both drugs and was responding very, very well. I have now missed 3 doses of Doxil due to shortage. I am treading water with the carbo, but am frustrated that I am no longer making progress towards remission. Then there is all of the stress involved with the shortage, not knowing if there is anything I can do or what will happen next or how long I will be in treatment. I am trying to continue to be a wife and mother, to hold down a job. This shortage is adding insult to injury, and I wonder why we are being asked to raise money to find cures when we can't even get access to the cures that exist now." That's the frustration that's out there on drug shortages, and I'm very pleased that this legislation will move us in the right direction on answering that question. I might tell you that it doesn't only affect those who are under active treatment, it also affects those, the number of clinical trials that we can participate. There are currently about 150 clinical trials at NIH involving cancer and trying to find the answers and cures for cancer. The problem is that on these clinical trials, they don't use placebos. They use the current drug therapy that is known for the treatment against an experimental process. Well, there's not enough drugs available to treat people for the current protocols. How can those drugs be used in a clinical trial? And as a result, we're finding it very challenging to move forward with the clinical trials that are needed. Once again, this legislation recognizes that concern, specifically deals with it, and I want to congratulate the committee leadership for addressing that issue. I also want to mention one other issue in nanotechnology and congratulate Senator Pryor for his leadership in this area. Programs at FDA to access the health safety effects of using nanotechnology in everyday products is something that we need to do, and this legislation advances that. I want to point out and proud that the lab facilities at FDA are fully capable of dealing with the challenges presented by nanotechnology, and this legislation acknowledges that. We also in Maryland are proud of the Beltsville Agricultural Research Center that has the capacity to advance nanotechnology and the impact it has on everyday products and safety. Those issues will be addressed also by the underlining bill, and we very much appreciate the leadership of the committee. Let me talk for a moment about the two amendments that I have brought forward. Amendment 2125, which deals with safety warnings, particularly as it affects the minority community. Clinical trials don't always represent the diversity of our community. We know there is underrepresentation of minorities within clinical trials. And quite frankly, when the FDA gives approval, they give approval to the known risks, as I'm sure you all are aware, but it doesn't always represent the impact on all communities. We also know that there are racial and ethnic differences in response to pharmaceuticals and that they may not become known until the drug is in wide use, certainly beyond the constraints of a controlled clinical trial. So we do have the initial approval of FDA that includes the known risks, but we also have the capacity under FDA to do post-approval warnings. And my amendment deals with that aspect of it. Health and Human Services has a strategy to deal with minority health and health disparities. It's called the Strategic Action Plan to Reduce Racial and Ethnic Health Disparities. We also now have an institute at the National Institutes of Health that deals solely with minority health and health disparity. We have a commitment to do a better job as a nation with dealing with minority health disparities. This amendment would help us move forward in that regard. One particular drug that is used to treat an inflammatory disorder has been determined by several studies to have a mortality risk that is 3 times higher for African Americans than the general public. However, it is still widely prescribed, and ads for the product on the Internet and on television prominently feature African American actors. This is an area in which the National Medical Association and many other groups who are concerned about the quality of minority health have focused on for years. Beyond the black box warning, which is the most serious warnings that can be issued about the side effects of approved drugs, there are other concerns about products that are marketed for the overall population that may have side effects, but the specific data has not been developed yet to warrant a black box warning. The amendment that I have offered directs the FDA to develop communication plans to address the best strategy for communicating benefits and risks, safety alerts, changes to the label or labeling of drugs, including black box warnings, biological product or devices, health advisories, any information identifying particular subpopulations and any other relevant information as determined appropriate to enhance communication, including a variety of means of electronic communication. I might point out that this amendment has the support of the FDA and BIO, and it is budget neutral. So I would urge my colleagues to support this amendment to advance the commitment that we all have made to deal with reducing and hopefully one day eliminating the disparities, minority health disparities in our health care system. It is totally consistent with the Strategic Action Plan to reduce racial and ethnic health disparities at the Department of Health and Human Services. The second amendment that I have brought forward, Amendment 2141, deals with the small businesses. This is very appropriate that this amendment is being considered during Small Business Week. We all acknowledge the importance of small business in the growth of our economy. 2 out of every 3 new jobs is created through small business. We get more innovation through our small businesses on a per-employee basis than we do through larger companies. It's critically important that small businesses be energized if our economy is going to rebound, as we know it needs to. This is particularly true as we deal with innovation in drug development or medical devices. My amendment deals with the issues of coordinating the work between the FDA and small business. It provides a listing of the staffing levels at the small business offices of the FDA so that we know the capacity we have and we can evaluate that. That's our responsibility to do that. It provides an overview of the status of partnership efforts between the FDA and the SBA. We want the 2 agencies, the Food and Drug Administration and Small Business Administration, to be working in concert to advance the cause for small businesses at the same time the mission of the FDA. My amendment provides a summary of all outreach efforts to small businesses and small businesses association. It details the number of small businesses receiving protocol assistance. It shows the number of unsolicited and solicited grant applications, again, to small businesses so that we can evaluate it. And most importantly, it calls for the examination of existing barriers, particularly as it relates to the generic drug shortages. It's interesting, the fee schedule, the FDA has the authority to do waivers as it relates to brand names. We know a lot of the generics are where we have our shortages because of the economics of the circumstances. But the SBA has limited ability to waive the fee structure as it relates to the development of generic drugs. My amendment would ask the SBA to report back to Congress what impact that has on small businesses being innovative in developing generic drugs to help us generally with less costly drugs are available for treatment, but also to make sure we deal with the drug shortage issue, which I alluded to earlier in my floor comments. This amendment is also supported by Senator Landrieu, the chairman of the Small Business Committee that I have the pleasure of serving on, and I would urge my colleagues to support both of the amendments that I have brought forward. I believe they only enhance the strength of the bill that's before us and is totally consistent with the work of the chairman and ranking member of the committee. With that, Mr. President, I would again urge my colleagues to support both amendments, support the underlining bill, and I would yield the floor.
Clerk will call the roll.
Mr. President, as